And good evening, everyone, and welcome to the Political Action Workshop of the Coalition of Black Trade Unions Detroit. And we are partnering with our wonderful, wonderful brothers and sisters in DC with the DC chapter. And we are pleased to have their president, Ms. Shauna Peace. Good evening, Madam President.
Good evening, Michael. How are you doing?
Doing fantastic and excited about this great program. Pardon me, guys. I think I just got a text from one of our guests. We were waiting, but we're going to go ahead and start. She said he'll be here in 2 minutes, Dr. Smitherman. But we're going to go ahead and start the program. Again, we thank everybody for this important information that we are going to be sharing with you. We have two of the most prominent doctors. I'm not going to call them African American doctors. We have two of the most prominent doctors in America tonight to provide information to you. And I will read our disclaimer that Sean and I worked on. CBTU Detroit and DC will not tell people to take the vaccine. Instead, we are focusing on providing facts for informed decision-making and provide information on how those who want to get the vaccine can get it. Now, we will provide you avenues to get access to the vaccine. If you choose to, in Detroit, use our vaccination stations. And I want to thank personally all of our partners. Gleaners would allow us to provide food for people who come in to get the shots. HAP providing the PPE, the Michigan Department of Health and Human Services, who are the professionals who provided the vaccinations, and Deion Williams out of the governor's office. Thank you for your partnership. And of course, Pastor Homer Jameson, the pastor of Jameson Temple Baptist Church, was our site. And that's one of the things that's great about this program, is that we are collaborating with other organizations to make this happen. So CBTU Detroit and DC, we're out there doing good in the neighborhood. Am I right, Jana?
Absolutely.
All right. So everybody, again, the program is designed to provide information. We title it Vaccines, What You Need to Know Now. And we want to save some lives. But before we start, we have a very special guest who provided a video for us. Phil, are you ready, bro?
About 2 seconds.
Okay, 2 seconds. Well, let me introduce her. Her name is Brenda Lawrence, and there she is. She is the congressional representative of the 14th district here in Michigan. She is also the second vice chair of the Congressional Black Caucus. She couldn't be here tonight with us because she's trying to make some laws, help people, but she did have an important message she wanted to share with us. Ladies and gentlemen, the Congresswoman of the 14th district in the state of Michigan, Brenda Lawrence.
Hello, I'm Congresswoman Brenda Lawrence, and I proudly represent Michigan's 14th Congressional District. I want to thank the Detroit chapter of the Coalition of Black Trade Unions for inviting me today to talk about the COVID-19 vaccine. I'm the second vice chair of the Congressional Black Caucus. And a few weeks ago,
we need a mute. Someone needs to mute.
Our members were doing a massive GOTV, get out the vaccine. We were reaching communities that have been hit the hardest this pandemic, like the Black community. We wanted to help to get more people vaccinated, more shots in arms. We were focused on the education, the awareness, and the accessibility of the vaccine in our community. In Michigan's 14th district, we partnered with 12 vaccine sites to create a walk-up vaccination center. No appointment needed. We partnered with 30 community organizations like the Detroit Lions, the Black sororities and fraternities, and I'm proud to say with my sisters, Delta Sigma Theta Incorporated, with our churches to help get the word out. Now, I know you know that the Black community is hit harder than any other group. We die disproportionately than any other group in America. We suffered and was hospitalized more than others. And something I always said when I was really pushing for education, our community, the Black community, needs all hands on deck. We are going through a dramatic stage in our history where we're fighting for criminal justice reform. We're fighting for police reform. We need to make sure that we're healthy. If we're sick, we cannot help each other. We're no value to our community. And the number of leaders in our Black communities, in our families, that we have lost to this virus, is just heartbreaking. We can stop that by getting the vaccine, by walking into the clinics where you don't need an appointment anymore. You don't have to say, I don't understand how we do that. You can walk into a Walgreens, to a CVS. We have them at churches, at city halls, the hospitals. We are doing everything we can do to make the vaccine accessible. I tell you, in the Black community, I need you healthy, and I absolutely need you alive. Our Get Out the Vaccine was a success. While we're able to get more shots in arms, we understand that there's much more work to do. It's efforts like what you are doing. You're hosting the vaccination station that will get more people vaccinated. It's about being directly in the community to make it accessible for anyone to walk in and easy and free to get their vaccine. I will admit, I had hesitancy at first. I was worried, I said, nah, am I gonna get sick? I don't know. Am I gonna grow a tail? Oh, wait a minute.
Bar any distractions, we're looking at the next heavyweight champion.
I was checking on you. Did you
It's
get
like,
the vaccine?
how can I say this? He was like,
He was sick, the died from the work, all the stuff, right? He said, Brenda, you worried about getting sick? Because nobody has died from it. I said, I'm worried about getting sick. He said, okay, Brenda, I'm gonna work through this with you. He said, Brenda, sick, dead, sick, dead. I can fix sick. I cannot fix dead. Get the vaccine. And the thing that really moved me, he said, Brenda, you are a leader in our community. I need you alive. I need you in Washington fighting for me. I need you for all the investment that the community has placed in you, for you to fulfill the expectations and take care of us. You can't do that if you're sick. Please get the vaccine. And I thought about that and took that to my Black community, the leaders that we have buried, who have had years of success, and even the young people who have died from this virus. I need you to continue to push. I'm so happy that we are continuing to encourage people because there's so much work to do. We have been on the coronavirus highway for too long. There's one exit to get off, and that's with the vaccine. So let's get off this highway of sickness and death and take the vaccine and get back to having families together, weddings, vacations, to be able to go to graduations, to be able to send our children to the classrooms. That's how we get back to growing, developing, and making sure our community is safe. Thank you for all the work that you're doing. I hope to see you soon. Take care, be safe, and I'll see you soon.
People die.
Michael, I believe you're on mute.
And I was sounding so good. I just want to tell you all, everybody. But again, we want to thank the Congresswoman, Brenda Lawrence from the 14th District here in Michigan. She has been doing an incredible job. And we just thank her so much for taking time out tonight. And everybody, we already started the program, but we're going to make the introductions again. I'm Michael Joseph. I'm the CBTU Detroit president. And the co-host tonight is Ms. Shauna Peace, the president of the DC chapter. You want to say hello, Shauna?
Hello, everyone. It's a pleasure to be here.
And our main man, the man is the glue. I used to call it Gorilla Glue, but you know, that's really a little strong. But Phil Holyfield, our second vice president, is here as well.
Thank you, thank you, thank you.
And we have two incredible doctors. You were here earlier. You heard me say, I'm not going to call them Black doctors. They're incredible doctors. And we're for points of information, for introduction, our president of the DC chapter, Ms. Shauna Pease.
Thank you. So earlier you were talking about collaborations and what a difference that can make. And I have been blessed to collaborate and be a part of the Black Coalition Against COVID with Dr. Reed Tuckson, who is a native Washingtonian, and he used to be the former Commissioner of Public Health in DC. He was pivotal in the AIDS and HIV pandemic as far as making sure that our communities knew what was going on and how, he could affect the communities in a positive way, because yet again, the mistrust that we have within the medical community as Black people, sometimes we don't trust what they say. And he was pivotal in making sure that we knew what was going on and what we could do to protect ourselves. So when he saw this almost happening again with the COVID pandemic, he selflessly decided to start the Black Coalition Against COVID. And through his efforts and through the efforts of others who are also on the steering committee, he has made such a difference in our community. And the important thing about it is he does this work from his heart, and that, and you can see it through the work that he does and how passionate he is about helping his community. And I just appreciate him. I'm so humbled and blessed to know this man and be able to call him a friend. So thank you so much, Dr. Tuckson, for joining us this evening.
Honored to be here, honored to be here.
In an intro, I had written out for you. Let me just read this one for y'all, because I was telling Dr. Tux before we came on the air, I've seen him on several programs around the country. And I told him, I feel like I know him. I said, man, I see him all the time on TV. But this is what I wrote about him. I said, Dr. Reed Tuckson is known as the doctor who doctors as government agencies and policymakers seek for answers. And we're going to seek some answers from tonight. And we have another dynamic young man, a guy I used to work with years ago. We used to work with youth violence in Detroit, and from the medical side of it, as well as psychological side of it. He is a great man. I'm honored to call him a friend, but let me give him this great introduction that he deserves. And by the way, he was doing another program and took time out to do our program tonight too. He wants to get the information out. Dr. Herbert Smitherman Jr. has been a physician in Detroit for over 33 years. He was on the front lines of treating coronavirus patients every day, especially in the early days of the pandemic, and a lot of his co-workers became ill trying to take care of other folk. He is the Wayne State University Vice Dean of Diversity and Community Affairs and Associate Professor of Internal Medicine. He is also President and CEO of Health Centers Detroit Foundation, and his research and expertise focus primarily on creating sustainable systems for care for urban communities. He's in the community helping folks, y'all. He currently, he spent the past 21 years working with diverse communities in Detroit to develop urban-based primary care delivery systems that integrate the health, social goals, and concerns of the community. Again, he's doing good in the neighborhood. He recently co-authored and released a book called Taking Care of the Uninsured, A Path to Reform. We are pleased to have with us the powerful, my brother, Dr. Herbert Smitherman Jr. Welcome, man. Good to see you, man.
Thank you very much. I greatly appreciate the invitation, and nice to see you, Reed. I haven't seen you in a while.
Hey, brother, good to work with you tonight. I'm glad.
Yes.
So we're going to get right to it, everybody. And the first question is from the DC CBTU Chair President, Ms. Shauna Pease.
Okay, so there's a link between well, first, let me just break it down this way. We have been hearing a lot with the CDC about, the restrictions going down. And, if you're vaccinated and you're going into small spaces or even outdoor spaces, that you no longer need to wear a mask. And so one of the first questions is, do we still need to wear a mask if we're vaccinated?
Herb, you want to start? Or?
Well, it doesn't matter which. I would say that, first of all, vaccination, especially with the current vaccines that are on the market with Pfizer, Moderna, they're 95% effective, still means you have a 5% chance of getting the virus. But what it does mean, if you're vaccinated, is that you won't get severely ill, hospitalized, or you won't die. So the protection is for severe illness and death. The goal we're trying to reach as a country, and the president has cited July 4th, is that we're trying to get to what's called herd immunity, where we essentially have enough people vaccinated that we will sort of decrease the spread of the virus. So it is, I would say, until we reach that. Right now, the country is about 48% of the country has at least gotten one dose or one shot, about 38% fully vaccinated. So I would say to be on the safe side, and that at this point, if you're outdoors, we're saying you don't really need a mask if you've been vaccinated. When you're going indoors, especially if you're around a group of vaccinated people, I think it's probably okay, especially if they're family members, you're all vaccinated. The chance of you getting infection is very, very low. If you're going in stores, et cetera, I think there are two issues. One is we want to still present and model for the country that we want to have people wearing masks, because there's still a significant part of the population that is still unvaccinated. And people don't know by just you walking in an enclosed environment in a store or a restaurant whether you've been vaccinated or not. So I would say until we get to a level where even if you're vaccinated, to where we're closer to what we want as herd immunity, I would say from social standpoint and from a scientific standpoint, it'd probably be better at this time to still be masked.
I really like the way that Herb laid that out, and let me augment it a little bit with a little bit of good news. The good news is that the statistics just reported have now shown us that we are across the United States, 61% of all Americans have received at least one dose, and 50% are fully vaccinated. So we have really made a lot of progress. But here's what I worry about, and it kind of gets at what Dr. Smitherman was saying. For those who are workers, and especially our essential workers, I am terrified for you, because now that we have opened up the society and saying that people can go do whatever they want to do around this country without having to wear a mask anymore, and you don't know that we're going to be exposing our frontline essential workers to a huge amount of risk, because you don't know when people come around you without a mask whether they have been vaccinated or not. And because you don't know, you are really, really walking naked. And I'll tell you that is scary because of the variants. We know now that these variants of the virus, the original strain of the virus is gone. Now it has been replaced with more serious strains, particularly the one from the United Kingdom. But if you look to India, and you've seen what's happening in India right now, that variant is just just devastated that country. Look at Brazil. That country is devastated. Those variants are moving their way here to the United States. And so my point is, along with what Herb is saying, is if I am out there as a worker and people are coming in my presence without a mask, I have no way to know on the honor system. And most of America ain't been honorable for a long time. So if I'm a
1619 project.
Thank you, my brother. And they don't even want to teach 1619. That's how unhonorable they are. And so you simply do not know. So I would just say, if you are one of those people, you got to get vaccinated, because you are walking into a terribly unknowable situation and your lives are at risk. And what your fellow citizens have already told you is they could give a damn about your life. They could care less about their life. I don't have to wear a mask because my individual rights are that I don't have to wear a mask. Even though I could kill you, I have the right not to wear a mask. Well, those maniacs are out there now. The other last thing I'll say, Shauna, to your great point, is that it is important that we hear what Dr. Smitherman has said. These vaccines work well. They are extraordinarily effective at keeping you from getting seriously ill or dying. And the way you know that they are working and how you know that they are safe is, I've already indicated, 62% of Americans have already gotten at least one dose. And what you are not seeing is any significant reports of anybody having bad effects. Certainly you'll have some minor soreness in your shoulder, some tiredness for a minute, maybe a headache, but you're not seeing all these dire conspiracy theory warnings. And what you are also seeing by this is that the hospitalization rate and the death rate have plummeted since the vaccines have been available. So we know that they work, and we know we're in a very good place. So the conclusion is, Shauna, it's a race to the finish line. Will we get enough people vaccinated in time before these variants take root and become unaffected by the vaccines we have now? But if you're an essential worker, please, you cannot play Russian roulette with the honesty of the American people.
And Doctor, I want to talk about that point, and I want to bring up and I suggest to all of you to read an article that Dr. Smithman wrote. It was in Bridge magazine in January. It was called "I'm a Black Doctor. Here's Why We Should All Take the COVID." I want to go back to your point. And by the way, before we continue, everybody, if you have a question you want to ask these brilliant men, go into the chat box, write it out, and Shauna, Phil, and myself, we will make sure that you get your question answered. So I'm going to roll something in here. I want to talk about what you were talking about, Dr. Reed, sir, about the workers and what you wrote about, Dr. Smitherman, in your article, and even Dr. Fauci, sorry, I mispronounced his name. Well, he said, let me just read a quote from him. "The undeniable effects of racism has led to unacceptable health disparities that especially hurt African Americans, Hispanics, and Native Americans during the pandemic. COVID-19 has shown a bright light on our society's failing." And Dr. Reed, you've talked about this, but Dr. Smithman, in your article, you said heavy poverty rates and higher burdens of disease are the results of 402 years of negative U.S. social, economic, political, and health policies resulting from enslavement, Jim Crow, lynching, and segregation. Gentlemen, you're talking about the workers, and primarily there'll be African American who work in those service jobs. There'll be Hispanics who work in those service jobs. Your thoughts?
Yeah, Dr. Tuckson brought up some very important points. These racial and ethnic groups are disproportionately represented among essential workers unable to work from their homes, like many other groups of people, resulting in higher risk for exposure to COVID, with potential secondary transmissions amongst their household members, including infants, children, adults, young adults. And in addition, disparities in social determinants of health, such as crowded living conditions, food and housing insecurity, wealth and educational gaps, and these kinds of racial discrimination, all contribute to disparities in this illness. And as you mentioned the article, I talk about the disparity in COVID-19 infections and death rates among the African Americans is not because we, for example, are somehow inherently more susceptible to getting the virus. The COVID-19 has just exposed how a long history of racial discriminations and institutional race-based policies have negatively impacted the Black community. These kinds of things, such as you referenced, such as economic and political policies, and unfair employment, unfair housing, redlining, an inappropriate justice system. I mean, these kinds of things put us at, especially economic disparities, put us at a significant disparate poverty levels and the related higher burdens of chronic illness. And we know that higher levels of pre-existing health conditions like asthma and heart disease and cancer and obesity, which occurs in Black and brown communities, will make the coronavirus particularly more deadly. And a lot of this is based on, as you referenced, about 400 years of negative U.S. social, economic, and political and health policy. So we are, as a community, Black and brown people are dying at 3 to 4 times higher rate from COVID. We have 3 to 4 times higher case rates, associated with this illness. I'm in Michigan. You know, I live in Detroit. You know, I'm second chocolate city. DC is the first chocolate city. I'll give you that. So
Okay, George Clinton told us
We'll
that.
take
George
it.
Clinton told us that. We got it.
we got it. So
As long as you know, that's fine.
you guys are number one. I got you. You're the real chocolate city, but you know, we're out there a little bit too.
We got that.
We got you. So and we're 14%. Black people are 14% of Michigan's population, but we accounted for 33% of the infections and 40% of the deaths in Michigan.
It's unbalanced. Like,
Yeah.
And Detroit is 80% African American, which is, and Detroit is about 7% of Michigan's population, but we were like 26% of all the infections, and we're 25% of the deaths. It is hitting Black and brown at a significantly disproportionate rate. We are the people more than any other group that needs to be vaccinated, or else it will continue to be devastating within our community.
Two things come out of that I think are very important. And let's just underscore the last point that was so clearly made. Because we have such an increased incidence of pre-existing diseases like diabetes, heart disease, pulmonary, lung disease, obesity, because we have those diseases, they make us more susceptible to bad outcomes from the virus. And so therefore, as he said, we are on the highest list of people who ought to be vaccinated. That's what the vaccine is important for, keeping people who have a predisposition to dying from not dying. That's why we now don't see our seniors dying anywhere near like we saw before. That's because almost all of our seniors are vaccinated and they are not dying. So remember that. But there's a second thing that comes out of this distrust that you, Michael, kind of raises. And that is that a lot of us use the distrust and the historical negative things that have happened to us as a reason not to take the vaccine. And when you trace that logic, it just doesn't make any sense. Now, remember that all of us as Black doctors who are suggesting that people think carefully, and you gave the ground rules earlier, we're not sort of shaking our fingers and say, you need to take the vaccine. But those of us who have decided that it's important for us to try to get you to think that way and to want to do that, we are Black too. I had the talk, my father had the talk with me. I had the talk with my son. I had the talk with my grandsons. My son died from a gunshot wound. You know, man, listen, we grew up in Black communities with Black people. We've gone through it all. And yet we have still come out the other side using our science training and our knowledge that says to you, it is important to get the vaccine. And I'll make this last quick point, Michael. One of the things that people use often as a legitimate anger about and a reason for distrust is the Tuskegee syphilis study experience. Everybody brings it up every time. I'll tell you what's kind of crazy about that is that study was so horrible because Black men who had a disease were denied access to the treatment that would have saved them. It really makes no logical sense for people to decide to use the Tuskegee study to deny your own self the medicine that would save your life. I just sent a camera crew down to film the descendants of the Tuskegee syphilis study. You'll be very interested to know they are vaccinated and they have, and they are making it very clear that they do not appreciate people using the death and misery and pain of their ancestors, of their father or their grandfather, to use that as an excuse to kill your own self and hurt the Black community. They resent that terribly. So I would just say to people who have distrust, I get it. It's okay to be distrustful. We have earned that distrust from painful reality in America. But at some point, you've got to get beyond distrust so you don't take a gun and shoot your own self. It makes no sense.
So I want to ask you, gentlemen, I want to get back to the vaccine. Is natural immunity better than the vaccine acquired immunity? Or is there such a thing?
Yeah, so once you get infected, and I will say it this way, everyone, I'd say in about 4, most 5 years, everyone in the country, probably the world, will have antibody. The issue is how you're going to get there. Everyone will get infected. It's going to happen. The issue is whether you're going to be infected and live through it, or you're going to decide to get the vaccine. But everyone is going to be exposed to this virus. And so we're just saying, I'm not sure why you would want to take the sort of Russian roulette and kind of determine or figure out, if you get infected, whether you're going to make it through. What we do know is that people will obtain natural immunity as long as you're not immunocompromised, you're on cancer therapy or something, but you will obtain natural immunity. We don't know how long the natural immunity lasts, and we actually don't know how long the vaccine immunity will last either. And so we're trying to work through that. Those are longitudinal studies that are ongoing. We do believe, though, that the vaccine immunity, there's some evidence that the vaccine immunity may give you longer and more significant protection. So we're saying, even if you've been infected with the virus, you've made it through, you have autoantibodies, we're still recommending that you get the vaccine, because we believe that that immunity will be stronger. And so it is very important for people to get that vaccine for that.
In addition, Michael, you may be asking also about whether or not people, and there are many people who think that if they can just try to live a healthy life and boost their immune system up with vitamins and other sort of things, that will protect them. The answer is no, it doesn't. However, we do want you to build up your immune system. We do want you to get plenty of sleep. We want you to exercise. We want you to eat properly, do all the things you're supposed to do, because that's what you need to be doing. But does that make you bulletproof for being able to overcome this virus? No. Remember that there are 3 million people around the world who are dead from this virus. There are almost 600,000 people in the United States alone who are dead from this disease. Many of them were eating properly, exercising properly, and so forth. Not all of them were because they were sick. So there is no way that you can say that I am taking zinc or vitamin whatever, calcium, or vitamin D. If I'm doing all those things, that will make me bulletproof from getting sick from this virus. No, you can't. It doesn't work that way.
Well, let me ask both of you. Go ahead, Sean.
I mean, in this day and age, we have access to so many things at our fingertips. So if you choose not to research or know about a subject, it's because you're choosing to. And so when you have a whole, group of people who are choosing not to get this vaccine, I mean, even hearing the numbers, I mean, knowing for a fact that, like Dr. Reed said, a lot of them are blaming the Tuskegee experiment. But the fact of the matter is that they were denied access to what they needed. And we're making it available to you, and you still don't want to take it. And so now the reason for your excuse to that doesn't hold weight, because it's there for you. We're trying to do everything that we can to make it accessible to you. And the fact of the matter that you're still not taking it, knowing that it's killing us, it's crazy to me. I don't understand that.
But what may be crazy to some other folk that you just talked about, and Dr. Reed, you talked about as well. People just take the one shot, say, hey, I don't need to take the second shot. I've taken the first one. Do folks need to take the second shot, or are they okay with just the one shot?
We want people to take the second shot. And the reason is that while the first shot will get you somewhere around 60+% in effectiveness, the only way to get to the 99.5% that Dr. Smitherman mentioned is to get the second shot. So you definitely want both.
Dr. Smith?
Yeah, that's exactly right. You want both. They're not interchangeable. So if you get the Pfizer, you have to get the Pfizer second shot, the Moderna second shot. So, but let me just say just something for about a minute. The secret of survival on our planet is change or evolution, and evolution allows us to adapt. And all living things on the planet change over time because of random genetic mistakes or mutations. Each coronavirus only lives hours or at most days. It's a short half-life. The half-life of a virus is measured in hours or days, not years. Each person who's infected with coronavirus has trillions of virus copies in them, and there are millions of people infected. That means we have a high burden of virus in the community at large. And every time the virus copies itself, you get random errors or mutations in their genetic code. And most of these random errors or mutations provide no advantage to the virus. However, some changes in these mutations can cause survival advantages. And so high replication rates of the virus means higher chance of mutations. And that is why vaccine immunization rates are important. If you immunize everyone, that decreases the viral load in the community. And by definition, that means less mutations because there's less virus, and you decrease the chance of vaccine escape. As Dr. Tuxson mentioned, we have potential variants coming across the ways, coming across the seas, because we have now, at least according to the CDC, I think there are 5 variants of concern in the United States. We have the UK variants, the South African variants, the Brazilian. We have a couple in California that came up in March of 2021. So we're seeing increased variants. The more mutations and variants you have, meaning not a lot of people are vaccinated and you have significant spread, the more variants, the more you have a chance of escaping the vaccine. If we can get the actual level of the virus down through vaccination, you have less chance of mutations and therefore variants and therefore escaping the vaccine. And that's why it's not only important to vaccinate Americans, which is critically what we're doing now, but the world is a very, very fluid environment, and people are always traveling. If we don't stop what's coming in India, if we don't stop what's coming in Indonesia, if we don't stop what's coming in Africa, which only 1% of the African continent is vaccinated, if we don't stop those things, we're never going to stop the mutations, and we're never going to be able to keep up with that. So vaccination is the key.
Another thing we need to stop, because people will go to grandma's house and lay on grandma's couch, and they're bringing that poison into grandma's house. We had a question. Someone was asking about the Biden vaccine truck. I believe that is Dino Galaxy. And I can just say CBTU Detroit, we work with the federal government, Homeland Security. And one of the things we talked about was we need to, they were doing Ford Field. And I said, hey, that's nice, but everybody's not coming to Ford Field. You need to go to where they're at. Gentlemen, but the question, and what I brought up at that time, was about the Johnson & Johnson vaccine. Now there's a lot of controversy because the homeless person, you're not going to be on that same corner in 3 weeks. So Johnson & Johnson was a good thing. But now people are afraid of the Johnson & Johnson. So I want to throw 2 quick questions with you guys and answer that. One, women who are pregnant or want to get pregnant, they're concerned about the Johnson & Johnson. Is it okay for a pregnant woman? And the same thing with erectile dysfunction. Some men are saying, hey, I'm scared that it may cause me to have ED. Your thoughts?
No, they don't have any worries at all. It does not have anything to do with erectile dysfunction. It has nothing to do with fertility, and it is safe for pregnant women to be able to take it, including even with breastfeeding. So those are things we can put to rest, very straightforward. And brothers, let's also remember this, that the one thing that will definitely mess with your situation is if you get the virus. So, remember that the virus is the scary part. For pregnant women, what is really scary for them is getting the virus, because it does not do well and is not a good friend of being pregnant. So it is much better for you to get the vaccine, even if you're pregnant, and certainly not to get the virus.
About pregnant women, if I can, real quick, Michael.
Go ahead.
So also now we know that 12-year-olds and up. And as a mom myself, I have a 12-year-old, and I know a lot of people in my position are also wondering about the safety of allowing their children to get vaccinated. And right now, the Pfizer is only the one available for children 12 and up. So is there a difference between how it would affect the children more so the vaccine with the kids? I know like some adults, their shoulders hurt or, things like that. Are there different effects that children might have being younger if they get the vaccine, or is there anything we should be concerned about when it comes to youth getting the vaccination?
Well, first of all, children are much, even with can you hear me?
Yeah.
Yes.
Yeah. So the quick answer is no. So I'm going to go. and let me start with pregnant women. In each of the studies, about 44,000 people were part of the clinical trials in the Moderna, the Pfizer, and the J&J. And although we did not initially test pregnant women, they are in trials at this point. But what happened is people within those studies became pregnant. So the reason that the American College of Obstetricians and Gynecologists and the Society of Maternal Fetal Medicine, and in conjunction with the CDC, said we support vaccination in pregnant women was because even though they were smaller groups within those study populations, there were people within the clinical trials who became pregnant during the trial period. And they found that there were no side effects on either the fetus or the mother. So our societies came out and said, hey, we recommend that these be offered and a chance for the women to get vaccinated, because what we do know is women who are pregnant who develop or get infected with the COVID the coronavirus have significantly bad outcomes, preterm births, challenges with the pregnancy, et cetera. So we know that there's much higher risk in that population, pregnant women, much higher than the benefit of getting vaccinated. And that's why, even though the clinical trials have not been completed for pregnant women, the recommendation from the societies is that they recommend vaccination.
Okay.
As for the kids, Shauna, first of all, we really do want to slow down for a second and make it very clear that parents want to have best for their children. And this decision that they have to make for 12 and up is an important decision, no question about it. We know now that there are at least more than 300 kids have died from COVID, but what we're particularly concerned about with our children is something called multiple inflammatory syndrome, where the virus causes a terrifically terrible effect on multiple organ systems of the child. And this is a serious issue that concerns us. We know that the vaccine was tested well in children 12 and up, and there were no different effects from side effects or concerns that we had in adults. And so that is very clear. The vaccines are safe for children 12 and up. And it is very important for our children to be able to be vaccinated so that they can have their childhood back. Our kids deserve to have sleepovers. They deserve to be able to play sports with other kids and not have to worry about a mask indoors. They deserve to have the family reunion where everybody can be indoors together without having to wear a mask. And they also deserve to be able to go back to school and safe. So it is very important. Your next question will obviously be, when will children under 12 be able to have access to a vaccine? Those studies are ongoing now, but it will not be at least until the fall that we will have that data that tells us it's safe. Kids that are 12 are much more alike kids that are 18 or adults, but kids that are 12 are very different than children 2 or 3. So those research has to go on now.
And I want to go
One quick question.
Can I say one thing to that? Just one add one. And actually, I agree 100% with Dr. Tuxton. I will add, though, that in the studies, not only was it found safe in children between 12 and 15, the effective rate was even higher in children than it was in adults.
Good point.
Oh, great.
Go ahead, Phil.
Yeah, I want to go back to what Dr. Smitherman spoke on, the mutation of the virus. And I guess my question is, with that going on, is there a possibility that there may be a need for a third or fourth vaccination?
Yes, we don't know. We're doing longitudinal studies to determine how long the immunity lasts, the vaccine immunity lasts. It may be like the influenza vaccine, where we give this on an annual basis, or it may be like the pneumovax, or the pneumococcal vaccine, which is every 10 years. We don't know yet. And so as we get better information, we will know how, first of all, if we need to give boosters and how frequent that booster should be given to the population. So we're still doing those tests right now. The last and maybe Reed knows more, but the last I saw in the data was we're still testing, but we saw that the vaccine immunity lasts at least 6 months, and we're still studying the population longitudinally to sort of determine how long those antibodies last.
Phil, I think your question is great, and Herb's answer was perfect. But let's just emphasize again. This pandemic is like a bonfire, and the more you put logs on the fire will burn. If you can get those logs off the fire, eventually you get this thing and it shuts down. And remember that in America, Black folks are still living in very segregated environments. Our communities are our communities. We're living together in so many ways. And so if we do not get rid of the bonfire in our community, then as Herb has indicated, that you then have this opportunity for these viruses to become endemic, which means they become part of the culture, part of the society. And that's what really worries me, is that in our communities, if we can't get our vaccination rates up from where they are now, and we're way behind, then this becomes part of our culture in our communities. That means that, yes, you will be having to have booster shots. And we already are seeing the manufacturers of the vaccines making booster shots, getting ready for the reality that America simply didn't get the job done. And because we didn't eliminate this thing, even though we still have a minute, that's why we're trying so hard to get it done. But I have a feeling that this may be with us for quite a while. And as that changes, as those viruses change, then we'll probably have to have new booster shots to deal with the changes.
And Doc, that was one of the questions I had written down. Will we need a booster shot in 6 months or forever? We'll talk about some safety issues. And going back to the kids going back to school, the risk of them catching or transmitting the virus to their parents, to their schoolmates. And how do we, and all of us, including with our children, because that's what Shauna was talking about, we were in our pre-production meetings, she was talking about her children. How do we stay safe during the summer?
Well, again, the reality here is that the only way you can stay safe is to get vaccinated. You gotta that's the simplest, easiest answer. If you are not going to get vaccinated during the summer, then you're going to need to have to wear your mask. So if you have a child who is below 12 and people come into that home and they are not vaccinated, then you're going to need to make sure that people are wearing their masks. If they're going to summer camp, those kids are going to have to wear their masks indoors, and they're going to have to practice social distancing. Outdoors, playing in the yards and so forth, they'll probably be okay. But it's indoors that you have to worry about. And so again, the simplest answer to those questions are get vaccinated, and you can go ahead and live your life. You don't have to worry about all these things.
Shauna, you have a question?
So I guess one of the questions that have been brought down was there is, I don't want to say millennials because I am a millennial and we get the bad rap for everything.
I'm an older millennial.
And I'm a real old millennial.
On my people, I don't want to come down on them, but I know we can be stubborn sometimes. I know myself included. And I know from what I've talked to people my age and younger, they have basically said, well, I've gone this long and haven't gotten sick. So, I don't feel like I'm at risk. And so what would be the best messaging that you guys think would be able to reach them, to tell them, even though you may not have gotten sick to the point where you need to be hospitalized or anything like that? What is some of the things that we might be able to encourage them in order to want to take the vaccine?
Well, I think the simple, straightforward answer to that is and you would say it in a more artful way, but it's not just about you. It's about your grandmother. It's about your parents. It's about your older uncles and aunts. It's about your family, because becoming vaccinated not only protects you, but it protects your family and friends and neighbors around you. This is a public health crisis, not an individual crisis. So this is impacting our community at large. So you're getting vaccinated to protect mom. And I think everybody loves their mom.
I would also just add, and that was the perfect answer, is remember this: if you are making the decision not to be vaccinated, then you have a moral obligation to other human beings, and especially to Black folk who you are living amongst and with, that you must then wear your mask. No one has the right to willfully walk around knowing that they may well have the virus in them. You can't see it. You don't know it. You don't know when you are carrying it. And when you know that this virus is transmitted by speaking, talking, laughing in front of another person, this is invisible spread. You can't see it. It happens invisibly. No one has the moral right to say, I'm not going to get vaccinated and I'm not going to wear a mask and I'm going to walk around with other people and expose them to the risk of death. So if you're not going to get vaccinated, that's your individual decision. Nobody can force you to do it. But the one thing you got to then say is, I will wear a mask all the time whenever I am encountering other human beings, because I don't have the moral right to sicken or kill you simply because I don't feel like doing what needs to be done.
And the sad part of this, gentleman and everybody, is that people are reacting violently. We just had an incident in Detroit at a restaurant where they were asked to put on masks and they terrorized the workers there. So we've got that. So gentlemen, we're in the rapid fire. So I'm going to throw some questions at you and some answers. Now, one of the things we mentioned, I didn't get an answer from you guys. So let me get an answer. The Johnson & Johnson, we know that people have problems with it, and about women's menstrual cycle. Is that affected by the Johnson & Johnson or any of the vaccines? And is Johnson & Johnson safe?
Johnson & Johnson is safe. If you look at the original data, it was 7 women associated with, or 6 to 7 women that are associated with 7 million vaccines. So you're talking about a potential DVT or potential blood clot occurring in 1 out of 1 million women. That would be the ratio. If you look at just birth control and women, I'm a clinician, we dispense and write prescriptions for birth control every day. The rate of blood clots in women who take birth controls are 1 in 3,000, not 1 in a million. So first, we did not know whether in the general population, we would see the same kind of rate of blood clot in people who were never vaccinated. I just think that it is unclear whether the vaccine was associated with this or not. After review of the data by both the European Union and the CDC and the federal government and the FDA, they determined that it was safe, and they did, in the pause of the vaccine. I believe the vaccine is safe. I feel comfortable with, even if let's say it even caused a DVT and it was a cause. You're talking about 1 out of a million, a chance of getting this. Like I said, we have a much higher rate of blood clots associated with birth control pills than we ever will have with that vaccine. So
as far as the menstrual cycles, no problem. It doesn't have any impact on it, and that's a false issue.
Okay, yeah. So thank you.
I'm sorry, rapid fire, sorry.
Yeah, no problem. Yeah, because people's got a lot of great questions. For example, this one. How long does the protection last for those who are vaccinated, and can I get vaccinated if I have COVID, or should I get vaccinated if I have COVID?
The COVID, yes, you should get vaccinated. The natural immunity, we believe, is obviously there. We don't believe it's as strong as the immunity that you receive with the vaccine. I'm sorry, what was the first question?
The first question was, how long does the protection last for people who have been vaccinated? But also, if I have COVID, should I get vaccinated?
Yeah, you should get vaccinated. Just wait until you're healthy, until your symptoms have gone away, and then get vaccinated. You don't have to wait the 90 days, because the 90 days was just because we had limited vaccine. We believe the immunity associated with the vaccine lasts longer.
A lot longer.
Yeah. Go ahead. And what does the vaccine do? Because that's creating a lot of anxiety for people. They're like, oh, what's in it and all this kind of stuff. What does the vaccine do?
So the vaccine does not have the virus in it. Let me state it again. The vaccine does not have the virus in it. What it does do is it allows you to program your body to make the antibodies that are specific to the virus, and thereby allowing your body then to take over and fight the disease. So again, it's just, I know we're rapid fire. So again, all it does is it gives your body the information. It's the blueprint that tells your body, oh, okay, I need to make antibodies that are very specific to a particular kind of virus. And now we do that, and then it attacks that virus.
I do want to say
Yes,
one
sir.
thing to
Go ahead,
that.
sir. Please.
I'm sorry.
No, please go ahead.
Yeah, I get this question in clinic. I got it actually today. I'm just coming out of my practice just a little while ago. But the people are concerned about how quick the vaccine was developed. Scientists, I always tell people, the scientists have been working on mRNA technology for 30 years. Technology not new. Application in a vaccine is new. We were able to ramp up so quickly in applying mRNA technology to a vaccine because of 30 years of science and research in this area. Vaccine doesn't play around with your chromosomes or your genes or your DNA. And as Dr. Tuxton.
No microchips.
Oh,
No microchips.
Yeah, well,
I wasn't even going to ask that one, Sean. I didn't want Dr. Tuxton to look at me. I don't want Dr. Tuxton to look at me like, come on, I'm like.
Now, hold on. Wait a second. Let me tell you something. Look, brother, I'm in urban Detroit. I get that question all the time. It is on social media. It is a big myth. And yes, the COVID vaccine was, they say that the COVID vaccine was developed to control the general population, either through this microchip tracking in our brains or something.
Or the 5G tower, I don't know.
Yeah, there is no vaccine microchip. I'm gonna say it again because I say it every day to somebody in my practice. There is no vaccine microchip, and the vaccine will not track people. It will not gather personal information into a database. I had to track down, where is this coming from? And when I researched it, the myth started after comments made by Bill Gates from the Gates Foundation about a digital certificate or a digital passport. Instead of you carrying around that little paper card, which you may lose, he said, hey, just have sort of a barcode on your iPhone. So it just has the fact that you got the vaccine and the dates in some kind of QR code or something like that. But let me tell you something.
Doctor, I call it internet
microchip. There ain't no microchip.
Internet ignorance. And I told them they track you by your cell phone.
Right.
That is true. Michael, but before I know we're getting close to wrapping up, I did want to mention an event with Black Coalition Against COVID. We do a lot of making it plain town halls, and we have one coming up June the 2nd, and it's going to be at 7 o'clock to 8:45 p.m. And it's going to be on, if you go to Facebook and you go to blackdoctor.org, you'll be able to access it. And I know how big we are about getting our hair done and getting our hair cut. And we get in there and we cut up in the shop. And so this is going to be a virtual cut up in the shop, and we'll get the information that we need.
Right, spread that information.
Right information. Educate information. Dr. Reed, did you want to add?
As we're closing out, we all know, look, what's the cultural center of the Black community is the barbershop and the beauty salon. And so what we're going to do is partner with the Black barber and Black beautician industry, working with them hand in glove. And we're presenting a show for barbers and salon owners to help them to understand why they need to be a big part of this fight. So everybody's tuned in. It's June 2nd at 7 p.m. And we will send you, Michael, the information out to your audience.
I can share with our I need a question.
Thanks, John.
I'm sorry.
I will say two other things about the myths, because I get these questions, and I got this one in my clinic earlier this morning. Does the COVID vaccine cause infertility or miscarriages? No, it does not. Very clear. It does not cause infertility. It does not cause miscarriages. Was it developed using fetal tissue or using pork and cow? The vaccines were not. There was not fetal tissue used in developing the vaccine. There are many religious people who I see in my practice, and they're concerned about pork and they're concerned about fetal tissue. It does not have that, and it does not cause infertility and miscarriage.
And there's a quick question about the trucking industry is in need of 1 million drivers, and there's a focus on making sure that they are essential workers who are vaccinated. The last question I want to, and we're going to close out in 1 second. The people who do get COVID, the body response to COVID after 6 months. Can you gentlemen tell us what happens when COVID attacks the body? And then some people who survive, there are survivors, but it is a hell of a thing to survive.
Herb, you want to go ahead?
Yeah. So if when the virus attacks the body, it's just like any virus, an adenovirus, a common rhinovirus or cold or whatever, it attacks the cells, it releases an immune cascade, and it causes you to have symptoms. And those symptoms are the fever, the chills, the muscle aches, the fatigue, etc. We do see people that are the long haulers that go into a more chronic stage of the virus. So it attacks all the cells in the body. You know, they have more heart disease, brain fog, more expanded, you know, kidney disease, et cetera, more clinical syndromes. You know, so it attacks all the organs in the body. What happens with most people is they're able to develop natural immunity that takes a while for it to get started. So once you get infected, you know, you have this little prodrome period between 2 to 5 days, then you get the infection. It usually lasts between 10 and 14 days, which is why we have people quarantined for that period of time. And then majority of the people get over it. The majority do, but you know, we have 600,000 people who it didn't get through, who didn't, you know, they died from this. And so it is sort of Russian roulette. The majority of the people who are dying were elderly. And I say there are three populations: those who said, you know, they were trying to run down people to get the vaccine; those who said, I'm gonna wait to see if somebody's going to develop horns and a tail, and I'll sit on the sidelines. And if that happens,
I was one of those.
Yeah, I'm gonna see it. You know, I'm just gonna wait there.
But now I have both mine.
Yeah, I got you. And then there are the people.
Me too.
We are the people who are the nose. We've gone through the people running over people. We've gotten a lot of the people on the sidelines coming and getting the vaccine. We're into the heavy nose, and especially in the Black and brown communities. And so we have to have, as Dr. Tuckson mentioned, the barbershop and these other innovative things to get to our community, to get rid of, to dispel the myths and get information to our community so they will make the right decision.
Dr. Tuckson, for your last statement to everybody, what you want to tell them?
I
If they
think
get COVID, what to do?
The last statement I'll make is that I come at this with love and compassion for my people. I have an undying love for Black people. And I have a particular concern about the people who work, the working men and women who are out there every day trying to do what they need to do to put food on the table for their children. It makes me absolutely irrationally angry to think that there are human beings in our society that would put those noble people at risk and would be willingly able and have no compulsion about spreading this virus to them. So I'm begging people, please, I hope that if you are one of those people that don't know quite yet, you need more information, reach out to Wayne State, reach out to the people there, reach out to the Black Coalition Against COVID, any of our 4 Black medical schools, our National Medical Association. Don't take your information from Pookie on the internet. Get reliable information so that you can make the right decision. And I hope that you do. But if you decide not to get vaccinated, then do the right thing. And that is wear a mask and don't kill somebody else.
Madam President?
I just think it's wonderful. And I appreciate both Dr. Herb and Dr. Reed for taking this time out to educate our communities about this issue, because we need to hear from people who look like us that we can trust. And so I definitely appreciate all of you for giving us this information. To my DC-tonians out there, you can get vaccinated almost at any pharmacy, at the grocery store, and you really don't need to have any more, you don't have to register anymore. You can just do walk-ins. Also check with your local churches, because a lot of them are also doing vaccines. So it's out there. It's possible to get it done if you want it. And we encourage you, just like when you bring a friend with you to get vaccinated, bring somebody else, bring them in. So we just encourage you to get vaccinated. I do. I know I can't speak on behalf of CBTU, but me personally, as a Black woman who's raising Black children, I would appreciate it. So just thank you so much, Michael, for this platform.
Well, thank you. Thank you for your partnership. Before we go, everybody, again, I want to echo, first of all, thank you. Folks, I really should, if I could have read the entire bio, it would blow your mind. These 2 men are incredible medical professionals. They're respected around the world. So we are honored, Dr. Reed Tuxton, Dr. Herbert Smitherman Jr. to be here. And we're going to call y'all again, so don't even think we ain't going to call y'all back. But we just want everybody to know how serious this is. And the Black Coalition Against COVID that Dr. Tuxton co-founded, the BCAC and the Black Doctor Organization, they have a website that you can go to. Forget about the internet ignorance. Go and get some knowledge and go to that website and get your questions answered. But we want to close. CBTU Detroit and CBTU DC dedicates this program to the families of the men and women who have lost their lives, who are suffering right now from long-time effects, or some who right now in the hospital just trying to breathe again. COVID has stolen joy from many CBTU families. Two of them were CBTU warriors, Arnold Miller, the Detroit chapter, and Michael Elliott from the Chicago chapter. They have placed their spears on the ground and joined the ancestors. Each of them demonstrated the essence of what our organization is about, fighting for the rights and dignity of workers around the world and providing assistance by serving the community. Brother Miller recruited and mentored new and seasoned skilled trade brothers and sisters. His passion for children shone like the bright light of their smiles when he was their Santa Claus, getting them food, clothing, and toys. Michael Elliott was a historian, a courageous community activist, and a voice for the voiceless. He fought for labor, LGBT rights, Asian lives, Palestinian lives, Black Lives Matter, police brutality and accountability, and against social injustice in South Africa, Detroit, Jena, Louisiana, and Chicago. May they rest in power. I would again want to thank President Peake for being here. I want to thank Phil Holyfield for holding us all together. And I want to thank you, my brothers and sisters, because we know many of you have already done the right thing, and many of you are going to do the right thing to stay safe and keep our community safe. God bless you. Take care of grandma. Thank you for watching. On behalf of CBTU Detroit and DC, peace.